Welcome back. We've been talking today with Debbie Love, who's the coordinator for the Muroc Family Education Center on Aging. And what else you got cooking over there?
Okay, we got a big grant.
Whoa.
A big grant. Okay, now what that means is there is money out there for those who don't make a lot of money with Social Security and Medicare. Okay. It's a little hard to understand. I'm just going to give you a couple examples, and what I'm going to encourage you to do is, if you think you might qualify, don't worry about what I tell you today. Call up and make an appointment, and we'll go through it together, because it's federal funds that are out there, and we want to grab it. One of the programs is called the Medicare Savings Plan. There's a couple ways you can qualify. If you're under 65 and draw Social Security disability, or you're 65 or older, there are two parts of this. One is it will help you pay for medications, and the other part will help you pay for the premiums for Medicare.
Okay.
They take $104 out a month to pay for your Medicare, and many of you may not know that if your income is not that high from Social Security, they should not be taking the $104 out.
Really?
Right.
Wow.
Really, yep. It takes about 30 minutes to do this. What happens is you bring in any information you have, I'll enter it into a computer, then I'll give you a printout of that, and then it takes about 3 to 4 weeks to see if you qualify. But 99.9% of the time, the people that come in qualify and did not know ahead of time that they do that. Now, there's a program called Medicare Savings Program, and that is from the state of Arkansas, and that helps pay the $104.
Okay.
Okay?
Okay.
There's a second program called Extra Help, and that's with your medications, and some of the drugs, as we know, are super expensive, super expensive.
Yeah. Ridiculously so.
And if your income, and I hate to say low enough, but if it's low enough, you will qualify for a program that sometimes can drop the price of your drugs from $200 a month to $2 a month.
Oh my goodness. Oh my goodness.
Yeah.
Yeah.
So I'm going to give you some samples here, and then your head's going to spin because it's a lot of numbers. But what I'm going to encourage you to do is just call me up and we'll see if you qualify.
Right.
Medicare Savings Program, that's the one that pays your $104 a month.
Okay.
If your monthly income for an individual is not more than $786, and for a couple, $1,054, they're also going to take a peek at your assets. Okay? Your house doesn't count and your car doesn't count.
Okay.
What they're simply going to look at is your bank account, basically.
Okay.
Okay? If you have not more than $7,880, as an individual, and a couple 10,620, you most likely are going to qualify to get the $104 a month back.
Okay.
There's 4 levels within that, and they go up at each level.
All right.
But that's the lowest level. The highest level is if your monthly income is not more than $1,313, as a couple not more than $1,765.
That would probably cover a whole lot of people.
It covers a whole bunch of people.
Yeah, on that one.
A whole bunch of people. And then again, we'll look at your assets. Remember, if you come in, or we can even do it over the phone. If you don't have the funds for the gasoline, we can do it over the telephone. We'll ask about your home, whether you rent it or own it, and we'll ask about your vehicle, but they do not count as assets. That's the good news. Now, the other one, for those of you who take a lot of medication, this is the one that can also be very helpful. It's called Extra Help with Prescription Medication. Comes through the federal government. As an individual, your monthly income no more than $957.50. As a couple, not more than $1,292.50. And again, they're going to look at your assets, and I won't bore you with those numbers because it's confusing, but your home and your car never ever count.
Never counts, okay.
So what I would encourage you to do is, this money is, we've got it now, is call us at 508-3880 and set up an appointment, and all you have to do is just bring in any documents you have, whether it's your Social Security statement. I have to have your bank account statement. It's all safe, though. It's all a federally funded site, so we don't have to worry about security with it. And anything that I keep from you will be shredded, so there's no chance of anybody stealing anybody's identity. But they're great programs, and most people do not know they're out there.
Sounds like the government went ahead and just did a blanket, let's take this 104 out of everybody's.
They did. That's what they do.
Yeah. And,
They did.
And there are people that it should
Yep.
not have been taken from.
That's
and now
correct.
They're trying to there's an addendum or amends that they're trying to.
They're backpedaling a little bit right now. Yeah, trying
That's
to
the
say.
best way to say it. They're
Backpedaling.
backpedaling.
Well, I hate to be that way, but
Yeah.
we find that the majority of people who come in to see us get the $104 back.
Yeah.
And on the prescription drugs, many of you take lots of drugs, due to medical conditions that have come as we age, as we know. And a lot of times we can really, really lower those costs. So I'd really encourage you to set up some time to just give me a call and we'll make an appointment. You can come in and we'll take care of you, because
That's a great program,
the
Debbie.
money is there and we're going to get it.
Yeah.
No matter what we have to do.
And if anybody's going to get it for you, it's Debbie.
I'm going to get it.
The tenacity of a pit bull.
Well, yeah, exactly. Yeah.
I love to tease Miss Debbie.
Yeah, well, my philosophy with everything is, if it's there, let's go get it.
Sure.
And it's there, so we
Yeah.
need to go get it.
And you've paid for it.
That's
You've-
correct.
Yeah.
You've worked your whole life.
Exactly.
Yeah, that's right.
That's what people, I don't want to take it. It's not
no.
charity.
No.
You absolutely have worked hard and deserve this.
That's exactly
So,
right.
Yeah.
That's exactly right.
So,
So it's just as easy as making a phone call, making an appointment, and I'll take care of entering the data in, and you'll get a copy of it. And if it doesn't go through as planned, then we'll just go and try it again.
yeah.
There's no harm
Go
in
to
trying
plan
more
B.
than once.
Exactly. What's plan B? We'll just keep trying.
Absolutely.
Yeah.
There are a lot of things out there. Anybody that's out there that's ever in question if they qualify for anything, a lot of things did change on January 1st with the introduction of the new health insurance marketplace.
Yes.
There were programs called Medicaid Spend Down. Those are gone now.
Right.
So it's pretty confusing right now. Things that you thought you might have or you thought you might qualify for, some of those programs are not available anymore. But I also went through the training for the healthcare marketplace insurance, and it's interesting.
Yeah.
But we'll help you.
Yeah.
If you're uninsured or you're not sure about your insurance, if you'll come in and be patient with us, we'll sit you down at a computer, we'll talk you through it, we'll help you try to understand it. We're not allowed to press the keys, you have to make the decisions on your own, but we can certainly walk you through the process.
And Debbie's an incredible resource, especially for this area, because there are very few people that have gone through the training for this.
Yep, that's true.
And we're very lucky to have you.
Well, lucky for them, they didn't go through it. No, I'm just kidding.
Yeah. Yeah, I know that was one of your high points to your.
you take it's pretty. You do 22 hours online. You take 6 quizzes and final exams, but when you get done, you have a pretty good feel for what's out there and who qualifies for what.
And that's absolutely the question everyone's asking, and then they really are throwing their hands up in the air. So we have someone in our area completely trained and qualified to help you.
We'll help you.
So, yep.
And actually, Janet Maruck also is just getting certified too. So, and you don't have to worry about having the equipment. We have the equipment in our facility.
Right.
So you just come in and we'll take
They'll
care
have
of you.
the computer set up for you, and as Debbie said, they can't press the keys for you.
Right.
And if you're not computer literate, that's okay.
That's okay.
That's
We'll help
easy
you.
too.
We'll help you.
Yeah.
Yeah.
Finding the keys can be made easy.
And I'll be honest, if you're illiterate, you come in and we'll read it to you, and then you can make your decisions. Because we've had some people come in that don't read and write very well, and that's okay, because we can tell you what's on the screen and let you make the decision you think is most appropriate for you.
Yeah. And we've got the Arkansas Insurance Exchange will be already gone by the time this airs.
Right.
But we're doing a program at Baxter Regional Medical Center on the 23rd of January from noon until 6 to help people as well.
Right.
So
It's
bringing
open to the public. Anybody can walk in. So.
And that's real important to understand too with our community support houses, various programs we've had recently. The Maruck Family Education Center on Aging is open every day, Monday through Friday, 9 to 4. And as just for your own sake, more than anything, please make an appointment with Debbie so that she can block out the time to help just you.
Right.
So,
Make
but
sure we address it. And,
yeah,
but she describes me as a dog, and that's probably most appropriate. I will go after it. She knows me too well.
I was thinking, no, that's not really what I did, but then I'm thinking, no, tenacious as a bulldog.
She knows I have
suppose.
5 dogs, so she's, yeah, we rescue a lot of dogs. And don't forget about April 26th. That's our fundraiser.
Yes.
Hanging out in the hangar at the airport. It's going to be fun. It's blue jeans and cowboy boots and food.
And a band, dancing.
And airplanes and jets. And
yeah.
How much fun is that?
Yeah, that'll be great.
Yeah, it'll be
Debbie,
fun.
thanks so much for coming in.
Thank
It's
you.
always so much fun to have you in.
Oh, it's my pleasure.
All right.
My pleasure.
One more time, that phone number people can reach you.
Phone number 508-3880. And if we're not there, leave a message. We promise we'll call you back right away.
And they're real good about that. So
Yep.
thanks so much for joining
My
us
pleasure,
today.
my pleasure.
Don't miss any of those upcoming events.
That's for sure.
And if you don't remember the dates or you didn't have a pen and didn't write them down, call the Muruck Family
Absolutely.
Education Center on Aging, and they will be happy to share that information
sure
with
will.
you. All right. We'll see you again next week. Thanks for joining us today for BRMC's Healthy Connections.